All right. Good day, everyone. Um, so those of us here on the WhatsApp platform, as well as those joining us via the YouTube platform, we are all welcome to this evening's CPD program. And we are looking forward to an exciting program together. So this evening is going to be a continuation of um, the discussion that we had last week, albeit in a different dimension. Um, so I will share the program outline briefly so that we can be familiar with the program that we have for the day. All right. So I think it's shared already. So we will have the opening prayer, announcements, and then after the announcement session, we will introduce the speaker for today. And the speaker will take over the um, the discussion, and after that we have the question and answer session. So we are hoping to have a very interactive session after the main presentation. And then after the interactive session, we would have final announcements, and then we recap today's discussion, and we end with the opening prayer. So once again, ladies and gentlemen, we are all welcome to today's special CPD event. And this event is jointly organized by Send Ghana and GAND. Okay, and it's on the front of Park Warning Label Advocacy. So like I mentioned earlier, it's going to be a continuation of last week's program, but today our facilitator will look at it from a different perspective. All right, so in terms of announcements, we would like to remind members of our CPD fee payments, especially members of GAND. So if you're a member of GAND and you will need the CPD point to renew your license at the end of the year, please, you are reminded to pay up your CPD fee and also ensure that you are in good standing so that you can enjoy this discounted rates. We know that the early bird rate is over. So currently up from now up to the middle of July, that's the 15th of July, members in good standing can still enjoy some discounts. I mean, really significant discounts compared to last year. So if you're in good standing and you missed the early bird rate, there's still opportunity for you to pay the discounted rates of 150 Ghana cedis only, 150 cedis only by the 15th of July, so that we can enjoy all the CPD points. Please, this particular CPD is open to all, it's free for all. I mean today's CPD, but cumulatively, for you to get all the CPD points from the programs we will have for the year, please pay up the CPD fee if you have not done so already. It's also a reminder to all members, especially for those of us who are yet to renew our membership. The GAND year starts from July and ends in June the following year. So the GAND year from July 2024 is ending at the end of this month, the 30th of June. So the renewal is open from this time onward. You can make your renewal early, so you can be in good standing and enjoy the discounted CPD rates. Okay, so please, it's also a reminder for us. And the renewal fee is 240 cedis for members. And then for new member registration, it's 250 Ghana cedis. And also, for those of us who have been enjoying our CPD programs and you want to be part of GAND, we are most welcome. In fact, I will encourage you, if you are not a member already, to register and be in good standing so that you can enjoy all the benefits, all the numerous benefits that our guest association has to offer for us every year. One amongst, the many benefits is the discounted CPD rates. So please register to be a member. It's just 250 cedis so that you can enjoy the discounted rates. We know already that for this year, those who have been in good standing, they were able to take advantage of the 100 Ghana cedi early bird rates. So it's an encouragement for us who are not members already to sign up and be part of us. And again, I also want to say that, we have a unique mix, a unique blend of CPD programs for us. Okay. I know that, out there are so many CPD programs. Some of them you pay some token and you get 20 CPD points. But hey, when we look at the CPD program that we have rolled out for the year, it's a mix of very exciting program, including today's program, special program. So that would also help broaden and expand our horizon and our knowledge and experiences. So I encourage us to sign up for the GAND program. All right. It's 4:17 now, and I think we should be starting that. We have about 76 members on call now. So we would start and hopefully our members can join us. So if for those of us who are here, we know that we also have the YouTube platform. That's there's also an avenue that we can sign up. Today, we have to first apologize for last week. The challenges that we had with joining the platform, especially the Zoom platform. Today, the challenge has been resolved. Okay, so but if it happens that you have any difficulty in joining the WhatsApp platform, please, you can join us via the YouTube platform as well. Thank you. All right, so I think we should be starting now. All right, so for today, we have a very special topic under consideration. And we have one of our own members, our executive member, a member of the governing board, who will be delivering the presentation. And I present to you, ladies and gentlemen, Mr. Joseph Dankwa. He's a registered dietitian and is the general secretary of our guest association, the Ghana Dietetic Nutrition and Dietetic Association. Ghana Academy of Nutrition and Dietetics. Pardon me, ladies and gentlemen. So he is our General Secretary. And today, Mr. J.B. Dankwa will speak to the topic Front of Pack Warning Labels and the role of stakeholders. The role of stakeholders. So what roles can we play um, um, uh, in the front of pack warning label advocacy? I have to mention that the front of pack warning label advocacy is really gaining traction in the country. There has been calls from several quarters, especially from after last week's CPD, calling for the team to come and speak to them more about the program. All right. So without much ado, I'm going to hand over the call to Mr. J.B. Dankwa. And I also have to mention that Mr. J.B. Dankwa is also the project liaison officer on behalf of GAND on the front of pack warning label advocacy projects. So, Mr. J.B. Dankwa, if you're on call, please, can you take over? Over to you, please.
Thank you very much, Dr. Collins Appiah. Good afternoon, good evening, good morning, ladies and gentlemen, wherever you may be. It's a very great honor to be presenting to you today on the front of pack warning labels and the role of stakeholders. Give me a minute and let me share my screen for the presentation. Please, can you all see my screen?
Yes, I can see your screen.
Okay, here we go. All right, so today's topic is on the front of pack warning labels and the role of stakeholders. I sure believe most of us have already seen and heard what GAND, in collaboration with Send Ghana, is doing around this subject. Over the past few months, the consortium made up of GAND and Send Ghana have embarked on this advocacy of mandatory front of pack warning label, and we've done quite a lot of work on this subject. So today, I'll be very privileged to take you through the project and how, as an organization, we can collaborate with stakeholders and talk also about the role of stakeholders in making this advocacy a success. When I say a success, then we are looking at the government finally getting to implement the front of pack warning label as a food policy, and also what we can do as stakeholders to help sustain the policy, because it doesn't end at the implementation. We need to put in the work to ensure that it is also sustained. All right. So this whole front of pack warning label thing has become a necessity today, especially for us as Ghanaians, because there is an increasing rate of non-communicable diseases all over the world. And according to the research, 7 out of 10 leading causes of death in 2021 were non-communicable diseases. And when you talk about non-communicable diseases, one of the major risk factors is connected to food. So when you come to Ghana, when you talk about the NCD burden, WHO has done a very good report on NCDs over the years. And you realize that as we grow as a people with age, okay, the number of people who die by NCDs increases. And also the number of diseases itself among the population is also on the increase. So it tells us that as we grow, it is important for us to take critical steps in ensuring that we prevent non-communicable diseases. When you look at the data displayed on the screen, this is Ghana's data in the year 2021 for persons aging from 30 to 34 years. I have put a red dot on the non-communicable diseases. I hope you are able to see it clearly. You realize that with the data on my left-hand side, there are only two non-communicable diseases, which are liver cancer and stroke. But as you progress, you realize that from age 35 to 39, the number of non-communicable diseases among this population of 35 to 39 years increases, even as the population who are sick also increases. So this trend continues all through. You realize that the blue line, which is actually the total number of people who died by non-communicable diseases by the age, also really increases. So at the end, you realize that from age 75 to 79 years, a lot of people die by stroke, die by ischemic heart disease, kidney diseases, diabetes, and cardiovascular diseases, and also prostate cancer. So our disease burden increases with age, and it is important as a country, when you see significant data like this, you might want to do something about it. So then, what then becomes the rationale for this food policy reform? We have it that 3 out of 4 adults with diabetes live in middle income countries. All right. And when you consider non-communicable diseases, NCDs yield worse outcomes in low and middle income countries. And that is where most countries on our continent, I mean Africa, that is where we find ourselves. We are mostly within the low to middle income countries. So the fact that you live on the African continent alone, all right, even burdens you with non-communicable diseases. And as we progress further, you would understand why this is so and why the front of pack warning labeling advocacy is very, very important. Secondly, over the years, we've seen a sharp increase in sugary drinks and ultra-processed foods. And these ultra-processed foods, we also call them in this advocacy as nutrients of concern. They add very high energy, added sugar, saturated fats, and high levels of sodium in our food. And that makes our Ghana food environment a problem. So Prof. Annan and his team did the research and realized that the Ghana food environment can majorly be described as obesogenic. And the food environment problem cuts across a lot of fields. So we can consider things like food prices. And you will be surprised to know that food prices, unhealthy foods are actually way cheaper than foods we classify as healthy foods in our profession. And when you live in an environment where unhealthy foods are rather cheaper, and at the same time, within the income bracket, we are in the low to middle income, then you realize that a lot of people are not going to be able to afford healthy foods. And for that matter, they are going to fall on the unhealthy foods, and these can lead to issues like overweight and obesity, which eventually causes non-communicable diseases. Another aspect of the food environment problem is the fact that the unhealthy foods are heavily marketed. They are heavily marketed because the industries have money to push advertisements. And it's sad to say that most of these advertisements, when it comes to the unhealthy foods, are especially directed towards children. When you take a critical look at the Ghana food environment again, it is actually very confusing when you look at the current food labels we have. Because when you look at a typical food label, sometimes they may make nutrition or health claims, even though the overall food might not be healthy. And if you consider institutions and programs that we attend, these sugar sweetened beverages and fizzy drinks are what we mostly serve at our functions, thereby promoting unhealthy foods. So the Ghana food environment in itself is a problem. And because of this problem, leading to non-communicable diseases, it is very thoughtful that we advocate to sanitize the Ghana food environment, hoping that once that is done, it is going to yield positive outcomes and have a positive impact on the number of non-communicable diseases that plague our population. Hence, policies are being developed every now and then, all right? And when these food policies are being developed, we look at these policies moving the population from a bad food environment, like an obesogenic food environment, into a healthier food environment. So some of the food policies that have been enacted over time are the front of pack warning label policy, which we are trying to bring on board in Ghana. There is also the market restriction policy when it comes to food. There is also the food-related taxes or fiscal policy for the promotion of healthy diets, and then the public food procurement policy. So the Ghana's food policies that are being developed evolve around these four policies. All right, and when all these four policies are enrolled, you realize that the impact is going to be very positive in changing the people and changing the food environment from it being obesogenic to a more healthier food environment. When you have a healthier food environment, it's easy for people to make healthier choices when it comes to food. Like it or not, day in, day out, you make choices of food. Even if it's something you don't plan against the following day. The following day comes and you would have to decide to eat because you need to eat anyway. And when you live in an environment where the food environment is very poor, where you have a lot of unhealthy foods, you have a lot of unhealthy food surrounding you. Psychologically, when you are hungry, when you need something to eat, unhealthy food is the first thing that comes in mind. And of course, in terms of accessibility, it is way easier to access these unhealthy foods that are rich in sugars, high in salt, high in unhealthy fats. It's way easier to access them than to access healthy foods. So these food policies are very, very important if you really want to bring a positive change in the Ghana food environment. So the FOPWL as a policy tool in Ghana. So FOPL, as I've already said, stands for the front of pack warning labeling, and it refers to labels or symbols that are placed on the front of food and beverage packages, and it quickly and easily informs consumers about the nutrient content of the product. And so far as the nutrient contents are concerned, the emphasis lie on the unhealthy food nutrients or the negative nutrients. All right. So the nutrients that can affect your health negatively, those are the ones the FOPWL policy seeks to highlight. And once it highlights these nutrients, the consumer is more careful when it comes to making a choice on what food item they want to buy when they go for grocery shopping. So practically, the FOPWL policy is to tell consumers that even though you have the freedom to choose what you want to buy, we are warning you about what you are buying contains, such that it contains too much salt, too much unhealthy fats, or too much sugar. All right. And once you are informed of these things, then you can make the choice whether to still go with it and be burdened by non-communicable diseases, or to avoid it for a healthier lifestyle or a lower risk to attaining non-communicable diseases. So someone may ask, why do we even need the front of pack warning labeling? And the first reason is that with what we have currently, which is the back of pack labels, these labels are limited in their use and understanding. All right. Not everybody would really understand when they pick a back of pack and read the label. They are just too technical for the layman to understand, as compared to the front of pack warning labeling. The front of pack warning labeling is pretty much direct. When you pick the package, you have written on it boldly, high sugar, high fat, high salt. So very quickly, you are able to understand it and you are able to make a quick decision, other than trying so hard to read a back of pack. Sometimes the fonts are even so tiny that you can barely see. And that is the reason why we need the FOPWL. Another reason is that nutrition claims are widespread and they can be very confusing and sometimes very misleading, because the industry or the manufacturers of these food products, they can be very, very smart. All right. Sometimes instead of putting the generic name of specific ingredients, they will tweak it and put, other names that the layman may not understand. Perhaps if they put sugar, people would know that, oh, this product has 60% of sugar, and they may avoid, even without the FOPWL. So they might put things like molasses, all right, or natural sugar, whatever that means, all right, or pure sugar, something that is misleading, or something that can convince, someone to go for that particular product, whilst they are thinking they are buying something that is healthy, but in actual sense, the product is not healthy. Okay, so it's the reason why we actually need the front of pack warning label. So when you check the history of food production, manufacturers have always had back of pack labels, and these have always been geared towards economics, trade, and do not in the slightest bit consider the health or public health safety. All right. So it's all about economic competition or trade wars for them. It's all about profits. Okay. And they do not consider public health safety, because if they did, I believe some measures would have been put in place to cut down some of these nutrients of concern already, looking at the current incidence and increasing rates of non-communicable diseases among our population. So I'd like to give you a bit of an insight in what to expect so far as Ghana's front of pack warning label policy drafts is concerned. When you look at this specific label that is displayed on the screens right now, this is what that can be termed as the traffic light. We all know red is danger, all right, so you don't even go there. Yellow can be moderate. It means you probably have to apply some moderation when you are consuming. And green literally means it's good, it's healthy. You can go ahead and consume. Now, consider this as a typical label, all right, on a particular food product. Industries are very smart, okay, and because they command a lot of resources in terms of money, they can push advertisements. And when they are advertising a product with a label like this, they are going to advertise it in a smarter way, such that they will pick the positive logo, which is, for this particular one, low fat, low saturated fats. Okay, all right, and they will market that to override or overshadow the fact that this same product is also very high in sugars. And it's the reason why the drafters of the Ghana's FOPWL thought it wise to come up with a four policy bundle document that will be rolled out concurrently. And the idea is that the four policy bundle document would bridge the gaps. All right. If you consider this particular one, for instance, there is a gap, and the gap is that sugars are high, which makes the overall nutritional quality of this product unhealthy. So when you consider the policy Ghana is coming up with, a single product that has a single warning label cannot have a positive labeling. So Ghana is coming up with a front of pack warning label, and we are doing the double duty. And the double duty means that it has a mandatory front of pack warning label, which means that if sugars are high, the companies or the industries are mandated to put on their label that sugar is high, fat is high, salt is high. So that is the mandatory front of pack warning label. And the other side that makes it a double duty FOPWL is that we are going to introduce the positive labeling or the positive logo. And the positive logo is going to be put on products that are healthy. I mean, all the nutrients are going to be considered to ensure that the overall nutritional quality of that particular food product is healthy. So, as I said, if a particular food product has just one negative or one warning label, that product can never have a positive logo or a positive labeling. It is also possible that a particular product can be formulated in such a way that it has no negative label or no warning label, but at the same time, in terms of the overall nutritional quality, that product may not necessarily be unhealthy. Such products are not going to have the positive labeling or the positive logo. If any industry wants the positive logo on any of their products, then they really must ensure that the total assessment of the overall nutritional quality of the product is actually positive. And when that level is attained, then that product can be given the positive logo or the positive labeling. And it's important to note that this front of pack warning labeling policy is what we call a low agency policy intervention. In the context that when you consider a similar low agency policy intervention like adding iodine to salt, you don't really need to be educated to benefit from such a policy. So consider front of pack warning label. Okay, once it is executed, you really don't have to put in a lot of cognitive efforts to identify whether or not a particular food is healthy. So we will usually define a low agency policy intervention in the context that when the intended beneficiaries have to do very little action or play no active role at all in need design implementation to derive the benefit from such an intervention. So when you compare the front of pack warning label policy to the back of pack, you realize that the back of pack is what you typically call a high agency policy intervention, in the sense that you really have to be educated. You have to take a critical look to read everything on the back of pack label to even understand the percentage of the nutrients or the composition of the particular food before you be able to make a suggestion. Before you be able to make a decision as to whether to consume, as to whether it is healthy or not. And sometimes, even as nutritionists and dietitians, not all of us really understand the information on the back of pack labels. So it is important for all of us to, push all our efforts behind the advocacy for the mandatory front of pack warning label as a low agency policy intervention. So, why stakeholders matter or why stakeholders are important. Front of pack warning label policies require a very broad multi-sectorial collaboration. It is not the kind of policy where one agency can successfully push its advocacy for it to be effective and successful. All right. So stakeholders are very, very important. And when I talk about stakeholders, I'm talking about every agency, every individual, every organization that can play important roles, even if it's very small, all right, to support its implementation and sustainability. Stakeholders help to ensure legitimacy, they help to ensure public trust, they help with effective design and successful enforcement of the policy framework. So when this project started, the technical team working on the project have met a lot of stakeholders, all right? And it makes us only understand and appreciate the relevance of these stakeholders in the implementation or advocacy of the policy as we expect. So in our work, we identified some key stakeholders such as the Ministry of Health and Food and Drugs Authority, the academia, who push research and model validation. So GAND had one task where we had to collaborate with the 5 public universities. So if you are following us on our various social media pages, you realize that we had moved from one public university to the other. We did all the 5 public universities trying to collaborate with academia to advocate for the front of pack warning label. And in all of this collaboration with these stakeholders, you realize the effectiveness because academia is now going to be aware of this problem, even though we are already aware of the fact that non-communicable diseases are on the rise, but also getting to know how the FOPWL can significantly contribute in reducing non-communicable diseases. People are going to direct their research focus in the universities towards looking at front of pack warning labeling and how it impacts our population. Another relevant key stakeholder is the civil society or the CSOs, what we call the civil society organizations, because they are experts in advocacy and public engagement. I'll skip the food industry for now. I'll come back to it. The media are also very, very important, and not just the traditional media. Today, social media is very active and commands a lot of engagement when it comes to public awareness. So the media in general can never be overemphasized when it comes to mobilizing key stakeholders to push a policy like the front of pack warning labeling. And international partners like the UNICEF, FAO, the Global Health Advocacy Incubators, all these are international partners that support financially and also give technical advice throughout the advocacy and drafting of the policy and implementation, seeing through to the sustainability of these kind of policies. And of course, consumers are very important. Whether we can boldly say that a particular policy has been successful or not, it depends on the kind of choices the consumer makes. So the consumer is also a very important key stakeholder. Of course, the Ghana Academy of Nutrition and Dietetics. This is a food policy, right? And as nutritionists and dietitians, we are the first line of action when it comes to advising Ghanaians or our population on what foods are healthy and what foods are not. So this is like a direct thematic area for us as an academy, and we must put in all our efforts in ensuring the success in driving the implementation of the front of pack warning labeling policy. So when you consider the key stakeholders, all right, now I can talk about the industries. Stakeholders can either be classified as enablers or barriers. And straight away, you know that industries are barriers to the enactment or implementation of policies like the front of pack warning labeling. All right. Why? Because this is definitely going to cut down their financial resources or profits when it is implemented and implemented successfully, because people are now going to avoid certain food products. People are now going to choose healthier foods over ultra processed foods. All right. So what industries typically do is that they will play a lot of politics into the implementation of policies like these, okay, by identifying regulation loopholes. All right, sometimes they can even take an organization like us to court. All right, and if you don't have the evidence to back what you are advocating for, they will end up influencing, certain agencies to ensure that these policies never comes to life, so that they can continue, making profits and making gains out of the population, and they don't even care when diseases like hypertension, cancer, stroke continue to kill masses among our population. So we really need to be aware of some of these industry tactics and man ourselves or strap ourselves with all the evidence we can, especially when it comes to educating the populace on the benefits or the positive impacts of the front of pack warning labeling when it is finally implemented. So the role of stakeholders. Now, advocacy groups and health organizations. These stakeholders, that is where we belong as nutritionists and dietitians. Because if you consider the big umbrella, which is Ministry of Health, and the Ministry of Health, you have the agencies like Ghana Health Service, CHAG, and all right? And most of us either work with Ghana Health Service or CHAG. So this is where we belong, all right? And our role is to champion the implementation of the front of pack warning label in order to promote public health, reduce non-communicable diseases, and empower consumers to make healthier choices, okay? And when we are able to do that, you realize that there is going to be a sharp decline in the incidence rates of non-communicable diseases. This has been realized in some countries like Brazil, Chile, where these policies have successfully been implemented, okay? And we are also encouraged to play the significant role of conducting research, raising public awareness, and lobbying for policy changes. So if you are at a position of influence and you find yourself within this scope of advocacy groups and health organizations, it is very important to identify the power you have and use the power you have to lobby or influence policy changes. Because once you do that, the overall marker is going to be that a lot of people are going to be healthy, and that can put our country on a better pedestal to economic development. Government agencies are responsible for developing and enforcing regulations related to FOP warning labels, and they need to establish clear guidelines in order to ensure compliance and monitor the effectiveness of the labels. This is directly linked to government agencies such as the Food and Drugs Authority and Ghana Standards Authority. All right, they are going to be the main implementers of this policy, and we expect that once these policies are implemented, there should be 100% clarity. There should be 100% clarity when it comes to the guidelines, and they should be able to enforce strict compliance and also monitor the effectiveness of the labels, which means that from time to time, occasionally, people from the Food and Drugs Authority should be able to go into the market, pick random products, all right, and check whether the products conform to standards. If they do not conform to standards of healthy limits of the nutrients of concern, then they have to make sure that the companies producing such products are lawfully punished. All right, that is how we expect that these agencies enforce the front of pack warning labeling policy when it finally comes into play. So these stakeholders play a very crucial role in the successful implementation of the policy, and these roles include a lot of advocacy, a lot of education, making sure that the public actually have trust in these organizations. Consumer groups and research institutions. Consumer groups are stakeholders that represent the interest of consumers, okay? And they advocate for the right of the consumer to have access to clear, accurate, and easy to understand information about what is contained in the food products they are consuming. So in this advocacy, our slogan is know what you eat. It's as simple as that. People have the right to know exactly what is contained in what they are consuming. And that is what consumer groups should advocate for. Research organizations are also very important because we would need the institutions, our academic institutions, to effectively, all right, do a lot of research into the effectiveness of the different FOPL labeling system and provide evidence and recommendations for their design and implementation. And I must commend Professor Mosla and his team, because when we met him, you realize that they have put in a lot of research. Every single statement in the policy draft is backed by research. And when that is done, it is very, very difficult and almost practically impossible for anyone to, refuse the implementation of such a policy. But even after it has been implemented, we want to encourage that research institutions continue to carry out researches in that direction in order to improve on the effectiveness of the policy to ensure that it is well sustained. Otherwise, when we fail at the implementation or the overall acceptability of the public, the industries are going to use that against us. All right, and policies are subject to change. All right, and when that happens, we do not want to find ourselves on the slopey side of this kind of injustice, all right, such that the policy, because of one or two due diligence that wasn't done, the policy will not come to life. We do that and we endanger the population's health, and I don't think that is what we want as academics. As health professionals, dietitians, nutritionists, medical doctors, we play a crucial role in educating consumers about the importance of the front of pack warning label, okay? And we need to give them this education in order to help them to make informed choices. So one of the things I did in the facility where I work is that I organized a presentation, and after the presentation, I made a strong suggestion that the sugar sweetened beverages and all the unhealthy foods that are sold at the facilities outpatient department, all right, should be taken away from there, because we cannot advocate or be counseling and advising patients to stay or away or avoid these fizzy drinks, but at the same time we market these fizzy drinks right under their noses. It means that we are promoting an obesogenic food environment, and that goes a very long way to complicate non-communicable diseases patients are already plagued with. And I am very happy to say that the administrations listened, and all of such products have been moved to the canteen, all right, and have been replaced by healthier products like juices, all right, and eggs that patients can buy at the OPD. If you really want the if you really want the ultra processed foods or the fizzy drinks or sugar sweetened beverages, then you might have to walk all the way to the canteen or go outside of the facility to get it. And that is one of the positive impacts we get if we do our work well as professionals. So legal aspects are also very important. And like I already said, industries can actually take organizations like Send Ghana and GAND to court because of this advocacy. And when that happens, we really need legal experts to ensure that the regulations are legally sound, all right, that they comply with international trade agreements, such that even though we are pushing for this advocacy, at the same time, we are not breaking any international trade agreements to which countries are signed on behalf of industries. So we really need the backing of legal experts in advocacies like the FOPWL. And we talk about international organizations. We have our advocacy, the front of pack warning labeling, being supported by the Global Health Advocacy Incubator. All right, they play a very critical role in providing us with guidelines, technical support, capacity building for promoting the global best practices for the FOPWL implementation globally. They have supported a lot of countries, and they are well aware and well vested in some of the challenges that have come up, especially when it comes to industry interference, and have effectively developed solutions, all right, that we can follow as a model, such that when such or the same interference come up during our advocacy, we will be able to face it squarely and defeat such interferences. So international organizations are also very, very, very important in helping push the implementation and successful sustainability of the front of pack warning label policy. Food industries, they are also important because they have a role, and they have a role, and their only role is what we expect for them to reformulate what they are producing to conform to healthier standards. We need them to adapt their products and packaging to comply with regulations, all right, and potentially invest in new labeling technologies. So once this is in full implementation, we expect that all food manufacturers would comply by changing their labels and putting the front of pack warning labels where they deserve to be. And if any industry is also producing something that is healthy, yeah, they can also apply for the positive logo, which will also inform consumers that this particular food is very, very healthy, so it is safe to consume. Because in as much as we are warning consumers about what is bad for their health, it is also our responsibility to make them aware or make them in the know of what is healthy for them to consume. Otherwise, if you only talk about what is bad, sometimes people become confused and do not know what to eat at all. So the positive logo is also a way to promote healthy foods and also direct consumers to the right type of foods to promote public health. So in all of this, throughout the drafts and even this advocacy, food industries were not invited as stakeholders, okay, because of interference. But after the implementation, I believe they will be invited so that, um, there will be a roundtable discussion of the entire policy and see how best the policy can actually be rolled out in such a way that the public health integrity will be maintained whilst it doesn't affect organizations or industries that much. So the key aspects of the stakeholder engagement include being involved in the design and development of the labeling policies and the outset to ensure the buy-in and address of potential concerns. Okay, and there has to be transparency and accountability on the part of stakeholders. By this, I mean that relevant stakeholders must have a bold declaration of conflict of interest. All right, you don't take money from industries that are producing ultra processed foods or foods that are um, a a problem to public health integrity and say that you are also advocating for front of pack warning labeling. No, that is a direct conflict of interest. All right. So we expect that stakeholders be very transparent and be very, very accountable. Because when that happens, the public will trust us more. And once the public trusts us, it makes education down to the lowest population very possible and easily accepted. And as stakeholders, we must enforce a strong collaboration and partnerships. Effective implementation of the FOPWL requires that we collaborate, we partner, all right? And once we do that, we are a stronger force for the industries to reckon with. So collaboration and partnership is a key aspect of stakeholder engagement that must not be taken lightly at all. When we are able to do that, it comes with some opportunities, and these opportunities include alignment with food policies. It helps us align food policies with the sustainable development goals. You know that sustainable development goals are developed by the United Nations to drive positive or a positive impact on public health. All right. And I must say that nutrition is at the center of all the 17 sustainable development goals. Without nutrition, it will be very, very difficult for the remaining 16 sustainable development goals to be achieved. Everything, economy, life in water, think about everything. One way or the other, it is directly or indirectly linked to nutrition. So the opportunity to align food policy with SDGs, it's a very huge one that we need to explore. Another opportunity is mobilizing academia for evidence generation, and that is an opportunity we have tapped in as GAND, going around the public universities, engaging with professors, heads of departments, students, all right, looking into evidence generation and evidence that must inform the implementation and the sustainability of the front of pack warning labeling. And we also have as an opportunity to develop national campaigns on label literacy. And lastly, enhancing cross-sector partnerships. So in this advocacy, we have involved the Ministry of Health, we have involved the Ministry of Education, we have involved the NDPC, all right? We have involved the FDA, we have involved a whole lot of public sectors, and all of us have come together as partners, talking about one thing or the other to ensure that this policy is effectively implemented for the advantage of the common Ghanaian and helping to improve public health. So to understand that collaboration is really necessary, I need you to listen to this remark by a representative from the NDPC.
Hello, Mr. Dankwa. The sound, there's no sound from the video, so please, could you check it for us?
The sound is not playing.
Yes, we can't hear the speaker.
Whoa, give me a second.
So, from the NDPC's point of view,
can you hear now?
We are committed to continue supporting the process of ensuring that the front of back labeling policy is finalized. We will then support the process of ensuring that the relevant institutions will plan adequately for it. So, Madam, just to respond to your question, how do we make sure we implement this properly? So, whether it's Ghana Education Service, where they have control over, we will support them to ensure that they have the necessary activities in their plans and that they budget accordingly for it. And it will be the same at the district level as well. And we'll also try and monitor the implementation of this policy. But ultimately, we need all of us here gathered to not only be advocates for it, but to make sure the relevant institutions are doing the work they do. So let's be each other's brother. Let's guardians, we make sure everyone is doing their work. It's not an easy thing to do, but we can reach there. Other countries have succeeded, we can do the same.
So all he was saying is that the NDPC are in full support and they are going to support agencies like the Ministry of Health and Ministry of Education on whatever role that is critical to these agencies, all right, to effectively plan for the implementation of the front of pack warning label. And this goes a long way to make us understand the necessity of collaboration when it comes to driving the implementation of this policy. So at this point, I would like to take a pause and take any questions you may have on today's presentation before I conclude.
All right. Thank you very much, Mr. JB Dankwa, for the very insightful presentation. The presentation was done as such a manner that you could easily follow and understand what the message that is passing across. Thank you very much for the hard work that you have put into this. So, members, we have heard Mr. J.B. Dankwa on the presentation on the front of park warning label, the role of stakeholders, the role of stakeholders. And he has mentioned, I mean, he summed up everything about the FOPL as the consumer knowing what he or she is eating. And so the essence of that is to empower the consumer right from the point of contact with the food product so that they get to know what kind of content the product has got, whether it's going to help or not. And then he mentioned the high rate of NCDs. I mean, for most of us here are health professionals, and we know the problem of non-communicable disease that we are currently grappling with as a country. Recently, it was on the news, the Minister of Health for Ghana mentioned that 43% of all deaths as a result of non-communicable diseases. 43%, ladies and gentlemen. That's almost half of all deaths in Ghana. That's really serious. That's really, really serious. So Mr. J.B. Danko has made us to appreciate the role of nutrition in the rising rate of non-communicable diseases and why it is so critical for the public to be empowered about what they are eating in order to protect the public from the menace of non-communicable diseases. All right, so I'll pause here and then I'll open the floor for members to share their views, comments, or if you have a question or specific contribution you want to make, the floor is open for you to also share with all of us. So please, you can indicate by raising your hand virtually, or you can also post your comments in the chat box. It will be read for the presenter to respond to. And then for those of us on the YouTube platform as well, you could also share your comment or your question for it to be addressed. So over to you, ladies and gentlemen. All right, so let's see the chat box. Yeah, so yeah, there's a comment by Professor Kinsley Preko in the chat box. So there has been some concerns about the inclusion of positive logo in our policy, that it waters down the relevance of the FOPL as it is an intervention to address the issues of nutrients of concern and its outcomes. WHO and Codex recommend a single logo and not multiple logo. So possible logo could cause confusion to consumers and could be exploited by industry to make ultra-processed foods appear healthier than they are. And there is little evidence to support how positive logos have fared alongside negative logos. So what is your take on these concerns, considering the path that Ghana is taking? So Mr. J.B. Dankwa, I remember clearly from the presentation that Ghana want to adopt the double duty FOPL. You mentioned the mandatory label or logo, as well as a positive labeling or positive logo. So Prof. Prepo is asking about your take on the potential downside of the positive logo that's he mentioned in this post. So please, do you have any views to share on that?
Yeah, so when we met the team lead for the policy draft, that's Prof. Emosla, the same thing came up, and I'm going to give the exact explanation he gave. All right, so in my presentation, I made mention that once a particular food product has one warning label, that product cannot have a positive logo. Even if the product has, one positive or a number of positive nutrients in it, as long as there is a warning logo or one of the nutrients exceeds the recommended threshold, all right, that product cannot have a positive logo. And I believe this concern is coming up because of recent developments such as fortification of unhealthy food products like bouillon cubes, all right, such that the industries will make that a point to rather market the positive aspects of the particular product, even though the overall healthiness of that product may be unhealthy. So, in my opinion, once a product has positive logo, it means that the product entire nutritional quality has been assessed and has been certified that the overall nutritional quality is healthy for the public's consumption, because we are assured that the draft is going to, what the draft is going to do is that once there is a single warning logo, you cannot have that positive logo. So if you really want a positive logo, then you really need to ensure that every single ingredient embedded in that particular food product is within healthful consumption of the public. I don't know if that is clear with Prof. Otherwise, I would appreciate if he can also throw insights from his perspective with us.
All right, Mr. JB Dankwa, thank you very much. Well, from my perspective, and I suppose some other members as well, it's very clear. So if Prof has another perspective to also share with us, he's most welcome to also go ahead. So effectively, the message that I am getting is that the overall nutritional quality of the food product must be healthy before it can assume a positive logo. And if there is any indication, even if one nutrient or component is unhealthy, it cannot assume the positive logo. All right.
That's
So,
correct.
yeah, thank you very much. Yes. So, Prof's hand was up briefly, but I don't know if it's fine. Pearl Bansa, your hand is up. Please unmute yourself and please proceed. Okay. So, all right. Please go ahead. You have
Hello.
been unmuted.
Good evening, everyone. How did you? Thank you for the presentation. Thank you for drawing our attention to more vital things. My problem has to do with language usage. At times, when you purchase some items, you realize that the language is in different language, not English, a common one that you can easily understand. And what is the law saying about that? Or what is the Food and Drug Board saying about that? And secondly, I bought some item from a mall, cheese ball. And when I got home, I realized that the expiring date has been cleaned. We have the expiry EXP there, but the date has been cleaned. In that situation, as a consumer, what do you do? How can you go and report such cases? Thank you.
Thank you very much. Thank you very much, Pearl, for your question. I really wished the FDA was here to address some of these concerns. Yes, clearly it is very wrong for us to have products in this country in a language that it's not declared as official. That is not in English. That is not what the law says. And the FDA has a regulatory mandate to ensure that all food products on the Ghanaian market are clearly labeled in English, because English is our official language. All right. When labels are in foreign languages without accurate English translations, it undermines our rights as consumers to information. And I believe the FDA can strengthen enforcement by requiring that all imported products have clearly legible English labels before they are cleared from the port, and also conducting routine market surveillance to identify and remove all the non-compliant products from the market. All right. Maybe they can also impose penalties or sanctions on importers or distributors who fail to meet these labeling standards, to serve, as a warning to others. So ultimately, it's about protecting the consumer's ability to make informed choices and reducing health risk. All right. To your second question, please, if you come across a product with an unclear or a smudged or a missing expiry date, I think first of all, you should confront the vendor right there and then. All right. Don't use the product, don't overlook it. At that point, you are the agent of change on behalf of all consumers who are likely to purchase the product. All right. So confront the vendor or the shop manager from wherever you bought the product from, because it is mandatory that all products should have, manufacturing and expiring dates. It's mandatory. Secondly, what you're supposed to do is to report to the FDA. All right. I believe they have a hotline on their website. And recently, if I'm not mistaken, there is an app from FDA where you can report, some of these non-compliant issues to them. And we believe that when that is done, they will follow up and take action. All right. So that when you make a formal report, the FDA will be able to trace the product batch and then take the necessary action, which may include market withdrawal or perhaps impose sanctions on the manufacturers or importers of these products. Thank you.
All right. Thank you very much, Mr. Dankwa, for the response. That's very clear. All right. So the next comments in the chat box from Steiner-Asiedu was a great presentation. And then Alice Ziaba also says it was an insightful presentation. Thanks, JB. Sophia Abetefe also mentioned that the presentation was great. All right.
Collins, Prof says he can't unmute. So if you can unmute him.
Paul, let's see. Paul. Okay, I'm trying to find him on the list.
He's on the list as Kingsley Preko.
Oh, you mean Prof?
Yeah, Prof Preko.
Okay, all right. Okay, so just a minute. All right. All right, so whilst waiting to unmute Prof, this is also a reminder for us that in fact, this is the first, and also a notice that the attendance sheet has been posted in the chat box. So please fill the attendance form so that you can get the CPD points. I'm struggling to get Prof. Recon.
Prof is not on the call.
Exactly. Okay, so please, if anyone has a question, you can raise your hand virtually and you'll be unmuted to speak. All right, so I continue reading the message in the chat box. Someone asked if the attendance can be shared. We have done so. So please fill the attendance form. Okay. So Akomia mentioned, in fact, before Akomia, Irene Pumplampu mentioned that great strides by GAND so far. Thank you for the presentation. Thank you very much. But I also want to acknowledge our collaborator through which this program has been possible, Send Ghana, and then the FOPWL team. The appreciation also goes to them as well. All right, so there's a question in the chat box I'm going to read from Akomia. It says, I am glad the NDPC has been roped into this. My challenge has been how we are going to fight these industries who are financial giants. They might end up getting other stakeholders compromised. The turkey tail policy is on my mind. Insightful presentation though. Well, it appears to be a comment rather than a question. However, if Mr. J.B. Duncan has anything to say to that, he's most welcome. Yeah, and Elsie Hayfron says, thank you, Aldi Duncan, for throwing more insights to this policy. All right, so essentially, the comments in the chat box. All right, so please, any question or comment? All stakeholders are needed. It's a point that was well emphasized by the speaker. And especially for most of us on the call who are nutrition professionals, he mentioned the things that we can do to push this advocacy. So those of us who are practicing in the hospital setting, let's make the hospital environment nutritionally, healthy. Let's sanitize. Let's push the hospital administration to implement policies that will weed out the unhealthy foods from the hospital environment, so that the patients who come around will have access to the healthy ones. Okay, so that's one thing that I gleaned from the presentation. All right, so please, any comment or question so far? He also mentioned that consumers are stakeholders. And to this, we are all consumers. So we have a role. We have double roles to play here. So we are stakeholders as health professionals to push this advocacy through our networks, the patients we come in contact with, when we have opportunity to do nutrition education on the various media platforms. Let's tailor in, let's bring in FOPL. Okay, let's educate the populace about FOPL and how it can help us improve the nutritional health and then of the population. Okay, right. And then for those of us in academia as well, let's also, consider research into effective ways of. There's a question. There's a hand up. So please, Ghana Canada Nutrition, you are trying to unmute so that you can speak. Please go ahead. You have been unmuted.
Good evening. Can you hear me?
Yes, we can hear you clearly and loudly.
Okay. I've been in and out. Sorry, my network is not working very well. But I just wanted to ask a question. And maybe this is either too far in advance, but a while back, I'll just give you the scenario. A while back, we had an advertising that was approved by the College of Physicians of blah, 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 regarding a particular type of oil. I don't want to make mention of it, but if I should, and if it's okay, can I make mention of this particular oil? That mentioned that the oil was cholesterol free and so forth. When we talk about approval from GAND or from dietitians, I would like to get a bit more information as to who would be involved in putting that approval together, the processes, in other words, the checkpoints that would be in place in order for that item to be approved and to receive that sticker. Just to make sure, and would it be a vote? Would it be based on the criteria that was met? Something has to be in place to ensure that in approving, that we don't approve based on biases and so forth. So that's why I'm asking that question, that as a body, indeed, we want to maintain that integrity and that leadership and trust from the public. So what would be in place? If I've missed it, please forgive me for asking this question. But what are the steps in place that would ensure that when our sticker is on a product, that it has undergone rigorous approval process, and what that approval process would look like? Thank you.
Yes, thank you very much for the question. Mr. Jebidanka, do you have any
Thank you very
perspective
much.
to share?
Thank you very much for the question. So the FDA is the primary regulatory body responsible for the approving and monitoring of all food labels, okay, including the nutrient content and health claims. All right. So to answer your first question, approval is going to come from FDA and none other. As of the processes, that one would have to go through, our industry would have to go through before the approval for like a positive logo is finalized. I'm not sure I have enough information to speak to that, but the policy draft, I'm told, as we discussed with FOPWL, has very detailed information as to all the processes the industries would have to go through before a product comes to a finalization to either have a warning label or a positive logo. And I believe the Ghana Standards Authority would also have a collaboration with the Food and Drugs Authority in setting the food labeling standards and the nutrient thresholds that will be used for the product evaluation. All right. And of course, talking about collaboration with stakeholders, public health experts are also very, very important. Okay, so the FDA would often consult advisory panels, like expert nutritionists, dietitians, food scientists, and even toxicologists. All of these expertise, I believe, they have in their domain before a conclusion is drawn. So I believe all these processes are laid down and very complete, and it is the only reason why the policy draft could go this far to the Ministry of Health. All right, so all we are asking is that let's add our voices to this advocacy, and once it comes into the public domain, once the policy draft comes to the public domain, we can also make our points and opinions known, and I believe they would be considered if they are laudable in coming to a final conclusion before the policy is finally implemented. Thank you. And one more thing, if you followed our symposium engagements with academia, there was a presentation on policy pathways, all right, which clearly outlined all the steps involved in bringing about the policy and how they are going to be implemented. So perhaps after today's program, I'll be happy to share some of the links to the symposia we held in the universities, and I believe that could give you a better clarification. Thank you.
All right. Thank you very much, Mr. JB Dankwa, for your response. All right. So, members, the floor is still open for additional questions and contributions, comments. Yeah. So, in the chats, Mr. David Atta says, great presentation. Thank you. All right. So, and as a professional body, GAND, we are also very careful about the kind of collaborations and partnership that we engage ourselves in. So it has to be something that would benefit our members. For example, the collaboration between Send Ghana and GAND, through which we are having this very insightful presentation, is the kind of example of collaborations that we do involve ourselves in. So if we are also with any civil society organization and we are into pushing the nutrition agenda in Ghana, and you want to partner with GAND on nutrition issues in addressing the health challenges that we have, please, you are welcome to contact the General Secretary for further discussion. All right, so our PRO's hand is up. So tell. Okay, so yes, please, you can go ahead.
Thank you very much. Thank you, General Secretary Joseph, for the very insightful presentation. I just wanted to add on to what you said about the role of FDA. With the question that was asked about agency responsible for regulation of food products in Ghana, law, FDA mandate to do that regulation, and usually their main focus is on ensuring the safety, the quality, and then ensuring that the efficacy of food products is good, including cosmetics, food, household items, and all. So they are mainly focused on the safety and quality. However, we know that it goes beyond that. We typically are looking at also the nutrient composition, the nutrients of public health concern, and all that. But they are mandated to ensure that the food is safe. So I remember in one of the engagements that we had with FDA, the FDA rep categorically stated it that that's their main focus. As to whether the food is high in fat, they cannot really tell the public that this food is high in fat, you shouldn't go for it. They are ensuring the quality and then the safety of the food. And they work in collaboration. They are supported by other agencies like the Ministry of Health, the Ghana Standard Authority, the Environmental Health, and of course, the veterinary services. So, by the law in Ghana, FDA is the one, but they do collaborate with other agencies. And with the front of pack warning that we are open is implemented, FDA is one of the agencies that we have collaborated with. They are one of the agencies that or the stakeholders that have been on this policy. So that's something that one question
All
that
right.
our system.
All right. Thank you, Pearl. I don't know if you okay, you are done. Thank you very much for the contribution, even though we struggle to hear you at some point, but the point is well made. So, ladies and gentlemen, I was just saying that GAND do partnership that benefits the members. So on the 10th of July, that's in 2 weeks time, one of our collaborations, collaboration that has been helping members would also happen. So there's a collaborative CPD event again, a special one again on the 10th of July, in partnership with the Nutrition and Dietetics Department at the University of Ghana. And we have the honor of hosting Professor Laurie Wright from the University of South Florida, the USA, to talk about nutrition intervention for healing and refeeding. So please look out for the flyers, the advertisement flyers on the various platforms, and mark the dates on your calendar. Thank you very much, ladies and gentlemen, for your patience. The attendance form has been shared on the YouTube platform as well as the WhatsApp platform that we currently are on. So please sign the attendance form. All right, so please comments are taken, questions are still being taken. Mr. JB mentioned, Dankwa mentioned that all hands are needed in whichever small ways we are all needed. So those of us in the consulting room, let's educate the patients, educate them on front of pack warning label, show them how to read nutrition information, the basic things, as he mentioned, to identify unhealthy food components. Okay, and then when we also get the platforms on radio or national TV, let's also chip in FOPL education to educate and empower the general Ghanaian populace. Thank you very much, ladies and gentlemen. Any comments or additional questions? All right, so with the announcements, again, we mentioned earlier at the start, so for those of us who might have missed that, I'll go over it again. That's the CPD registration is still open. Though the early bird fee timeline is passed, but we still have the opportunity to pay a discounted fee up to the 15th of July, only 150 Ghana cedis for all the plenty insightful topics that you have for us for the year. Okay. Please, let's pay up if we haven't done so. And if you want to join GAND as a member, we are most welcome. Please visit gandonline.org. All the information is there and the processes are there. It's at 100. It's 250 cedis for new members, and then for us members, the financial year for GAN from July last year is ending at the end of June, this June. So it's time for us to also renew our membership so that we can enjoy the early bird discounted rates and the current discounted rate as well. So please, let's pay up and renew our membership. That is at 240 Ghana cedis. All right. Yes, so there's also a hand up. It's the PRA again. So Pearl, please go ahead.
Uh, Give us about 5 minutes for that to briefly do that membership and renew out the website. That year is ending on the 30th of June. We are going to open up new registrations and renewal from the 1st of July. There's been a few changes that our web designer has made on the website. So if you would for a few minutes, about 5 to 10 minutes, so that explain how when we
All
go
right.
on to the renew.
Thank you, Pearl. We could hardly hear you, but I think we have got the message. So we would I hand over the platform to our IT manager, Mr. Franklin Hersey. Please, if you are on call, over to you. Please, just 3 minutes. 3 minutes, please. Thank you.
All right. Thank you. So because the GAN year is starting afresh, we decided to roll up the new system as I discussed last week or last 2 weeks. So the new dashboard will have a login like this, and then a registration like this, which will be simple. And then you go through the activation process again. The activation process is to help us make sure that whoever is signing up is real and legit. So when you log in, I'll log in with this account. If you log in, this is how your dashboard will look like, right? So you have your yearly, sorry, this is a type why I made it mentally here, but you have a yearly subscription. If it's not active, you see it inactive, and then the time it was valid. And then we'll also be implementing event and CPD like this. So all events will be here, the coming up events, and then the previous or past events, like how we are seeing it currently here. And then our CPDs that we have attended to, we will see it here by year. So currently, if we start it, you see the total CPD points per category, and then the form that you fill. Your CPD forms will now be filled from the dashboard, no more Google form. So until otherwise stated, they'll all be on the dashboard. So you know the CPD form that you have filled, the points that you have accrued, so that you know, come and say I have attended this CPD and then I did not see the form to fill. So everybody will be able to see all those information. And then we also have a calendar here to show us all the necessary events that will be coming up. Yes, and we'll be having job board as well, where we're posting job links for people to apply for jobs that are available. And then those who qualify to write some articles will also be given the opportunity to write some articles for us. And for we the members, we'll also be having these find members here. So you can be able to reach out to your members that you have been looking up for. For instance, you want a dietitian in a different region and you want to reach out to, or you want a nutritionist somewhere, you can use the region over here, or the place of work, or the profession of the person, and then you see their WhatsApp number or their telephone number to reach out to them. And then you also be able to see your subscription status. So if your subscription ends, you come to your subscription status and then click on the yearly plan, which is what we have, and then you pay. These are all damn information. So by 1st July, you'll be able to have that. And then we also have resource center, where we'll be able to find certain resources that are available, and then important contacts that you would like to reach out to. Yes, and then the last one has to do with our store. There will be some products that will be available, like tags, card stickers, mag, and all that, lab coats and all that. That will be available for users to. Emails are integrated, and then when you all users will be migrated to this account. So what you just have to do is to reset your password. And like I said, every 6 months we try to reset the GAN members account. So this June ending will be the 6 months to get a new password for your account. When you go in, you just reset your password, and then come to your settings, fill up your details here. They are very, very important. These informations are very, very important. Your profession, your place of work, and all that. And then you come to your dashboard to see other information. You see your GAN number and all that. If you have any question, you just come to the help and then fill up a form, and then we'll reach out to you via email or telephone calls. So basically, that's just a short description of the new dashboard that we'll be having. Thank you.
Thank you very much, Mr. Frank Casey, for the education on the GAND website. So ladies and gentlemen, we can see why we have to be members of GAND. Okay, so now we have a system where all the CPD points will be organized so that at the end of the year, you know, you don't have to be sending emails and WhatsApp messages and calls to the secretary and the CPD chair. And sometimes these tend to even drag into the new year. You miss the registration and becomes very frustrating. So please, let's sign up to be full members so that we can benefit from all these resources that GAN has made available for us.
It's really helping me
So,
do this.
ladies and gentlemen, on the program, there's recap after the Q&A. I think I've been doing that alongside. So I wouldn't have to do that again, or we won't need that again. So last on the agenda will be the prayer for to close us for this evening. It's exactly 6 o'clock. So we will take the closing prayer and call it a wonderful evening. So we want a volunteer to pray for us. I think because we need to mute someone. So who does that for us now? So I see Sarah Labi. Yeah. So Franklin, please, could you help unmute Sarah Labi for us to give us the closing prayer?
Yeah, she can.
Okay. All right. So Sarah, are you able to speak? Please unmute yourself and give us a closing prayer. Okay. It appears Sarah is having a challenge. So then I'm going to take it myself so that we close right on time. So our Heavenly Father, we thank you for this evening, for such a wonderful and insightful presentation that we have received. We are praying that you give us the grace and the strength to contribute our quota in driving the front of park warning label advocacy in our own small way, in the spaces and the spheres that we find ourselves, so that ultimately we push the nutrition and health agenda of Ghana to the optimal level that it should be. We want to thank you. We pray that as we go, as we continue our evening, you'll be with us. And next time we meet, we all come healthy and strong to learn and improve our capacities. Thank you, Lord, for in the name of our Lord Jesus Christ, we pray. Amen. All right. So, ladies and gentlemen, thank you very much. Please ensure that you have filled the attendance form before you log off. Do have a very pleasant evening.